name is Darlene, and I'm going to be the nurse doing your assessment today. How are we doing?
Perfect.
All right, can you tell me your name?
Amira.
Well, it's nice to meet you, Amira. I'm going to be listening and feeling of your belly, okay? And then I'm also going to be testing to see how strong you are in all your muscles and see how good your balance is, all right? Okay. So for me to be able to see how your belly's doing, I'm going to have to be able to look at it and touch it and listen to it, and that involves me kind of having to move your shirt out of the way up to about here. Is that okay? Okay, so I'm just going to roll your shirt up. I'm going to have to pull the waistband of your pants down just a little bit, okay? So I'm going to start off by looking at your stomach and then listening to your stomach, okay? All right. So the skin in the abdominal area is appropriate color for ethnicity. There's no lesions, scars, rashes, or outward signs of any type of masses or anything of that nature. No scabs present. I'm now going to listen using the diaphragm of my stethoscope for the gastric region. I'm going to start in the left upper quadrant. Vowel sounds are normal. Left lower quadrant. Vowel sounds are normal. Right lower quadrant. Vowel sounds are normal. Right upper quadrant. Vowel sounds are normal. So now I'm going to listen to your abdominal aorta and your renal and iliac arteries using the bell of my stethoscope, okay? So listen to the abdominal aorta. No bruits heard. The left renal arteries. No bruits heard. Left iliac arteries. No bruits heard. Right iliac. No bruits heard. The right renal arteries. No bruits heard. Perfect. All right. Excuse me. Now I'm going to take in percuss. So I'm going to just kind of like take my little hammer and tap on my fingers all over your belly, okay? So in my right upper quadrant. There's some dullness. Left upper quadrant. Dullness. Left lower quadrant. Dullness. And then right lower quadrant. Some dullness. Perfect. Alright, so now I'm just going to palpate your belly, okay? Use some light palpation in the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Now I'm going to do some deep palpation, so I'm going to press just a little bit deeper. So right upper quadrant, left upper quadrant, left lower quadrant, and then right lower quadrant. Any pain when I do that? Hurts over there? Okay. I'm going to push down on your belly right here, and I want you to let me know if you feel any pain over here, okay? Ready? Did you feel any pain over here? All right, perfect. All right, now I'm going to take and have you take a deep breath as I push upward underneath your ribs, looking for Murphy's sign, okay? Ready? And go. But you got to relax your belly and breathe in, okay? Breathe in. Perfect. No tenderness noted. Now I'm going to use the hook method to feel your liver, okay? That's where I'm going to have to kind of hook my fingers up underneath you. So I'm going to come behind you to do this, okay? All right. So take a big deep breath in. No liver was able to be palpated. And now I'm going to try and see if I can feel your spleen, okay? So I'm putting my right hand underneath the costovertebral angle on the left side, And I'm going to push down as you breathe in. So breathe in, big deep breath. Perfect. No spleen was able to be palpated. Now I'm just going to palpate for your aorta. Aorta is normal in size. And now I'm going to pull your shirt down. And I'm going to sit you up. And I'm going to check for some tenderness in the costovertebral angle. So I'm going to move your hair to the side. I'll place my hand. I need you to kind of try to sit up straight for me there, okay? I'll put my hand to the side here. And no tenderness noted on the left-hand side. And now I'm going to do the right side. No tenderness on the right-hand side noted. So that's pretty good. So it looks like everything was normal in our GI assessment. So I'm going to have you kind of sit forward for me. And I am going to stand up, and I'm going to have you copy some of my movements, okay? So I'm going to have you scoot down here. Okay, perfect. So I'm going to have you tuck your chin onto your chest and look down to flex your neck. And then you're going to look up to the sky. We're going to extend our neck, so both of those are normal. So now you're going to look to my left and look to my right. Perfect. Now I'm going to have you try to touch your ear to your shoulder. The other side. Perfect. So flexion extension of the neck is intact. Lateral bending is intact. And rotation is intact in the cervical spine. Now I'm going to test cranial nerve 11, which is your sternocleidomastoid muscle. So I'm going to put my hands on top of your shoulders, and I want you to shrug up like you're saying, I don't know. Ready, and go.
I don't know.
That's perfect. Okay, I'll place my hand against your cheek, and I'm going to try to turn your head this way. Don't let me, okay? Ready, and go.
No.
Perfect. Now the other side.
No.
Perfect. Cranial nerve 11, the sternocleidomastoid muscle, or cranial nerve, is intact. Now what I'm going to do is we're going to test your upper body strength, okay? You ready to test your muscles? Okay. So first we're going to make sure that you can move all of your muscles first, and then we're going to test your strength, okay? So I want you to stand up for me. And you're going to take your arms and you're just going to go straight up all the way. And that's going to be your flexion of your shoulder. And you're going to take them all the way back down. That's going to be your extension of your shoulder. Flexion and extension is intact. Now we're going to take the back of your hand, and you're going to touch your opposite shoulder blade, okay? Can you show me? Here, turn just like this so I can see you from the side. Perfect. Now do the other side. Perfect. So our internal rotation of our shoulder is intact. Now we're going to do our external rotation. So I'm going to have your hands out like this. And then I'm going to turn them out like this. Turn them back in. And turn them out. So our external rotation is intact. Now I'm going to have you have your arms straight at your side, palms facing out, and I want you to flex your elbows. So you're going to try to touch your elbows. No, we're not going to do this. We're going to keep them in front. And you're going to perfect. Now we're going to extend them back down. So elbow flexion and extension is intact. Now we're going to have our hands out in front of us. I want you to turn them palm up. So supination is intact. Now turn them palm down. Pronation is intact. Now I want you to pull your fingers up toward the sky. Our wrist extension is intact. I want you to push your fingers like you're going towards your forearm. Our wrist flexion is intact. Now I want you to make a fist. So our finger flexion is intact. Straighten out your hands. Our finger extension is intact. And now I want you to touch your thumb to every fingertip. Perfect. So our thumb opposition is intact. Put your hands out like this, where I can see them. Perfect. And now we're going to have our thumb go in, out, in, and out. And our thumb flexion and extension is intact. And now we're going to put our hands flat out again. And I want you to turn your fingers in like this and out. So our radial, not this, we're not doing this. Keeping them flat. and turn them in. Perfect. So our radial deviation is intact. Do the opposite. Perfect. And our ulnar deviation is intact. Now I'm going to see how strong you are in all those muscles. Are you ready? Okay. So I'm going to push your arms down. I want you to try to not let me push them against you, okay? You ready? And go. Perfect. So shoulder abduction is 5 out of strength is 5 out of 5. And now I'm going to do the opposite. So I'm going to push out and I want you to push in and not let me push your arms out like this, okay? Ready and go. Perfect. Shoulder adduction is intact, strength 5 out of 5. Now we're going to do the same thing with your elbows. So I'm going to push down. I want you to keep me from pushing your arms down, okay? So ready and go. Push them down. Perfect. So our elbow flexion strength is 5 out of 5. And so now I'm going to try to push them up. I don't want you to let me, okay? Ready and go. So perfect. Elbow extension strength is 5 out of 5. I am going to have you put your hands down like this. I'm going to push them down, okay? I want you to keep me from pushing them. I'll push them up. I'm sorry, push them up. I want you to keep me from pushing them up, okay? Ready and go. Keep me from pushing them up. Ready and go. Perfect. Wrist extension or flexion is strength 5 out of 5. Now we're going to do the opposite. Hold your hands up. I'm going to try to push them down. Do not let me. Ready and go. Perfect. Wrist extension strength is 5 out of 5. I want you to squeeze my fingers as hard as you can. Grip strength is 5 out of 5. Okay. And now I'm going to have you spread your fingers apart. So our finger abduction, abduct them, so pull them apart, pull them back together. That's our adduction, abduction, adduction. So our fingers abduction and adduction are intact. So I'm going to take and put my fingers kind of in between yours, or try and pull them apart. I don't want you to let me pull them apart. Are you ready? And go. Don't let me pull them apart. Perfect. One more time. Don't let me pull them apart. Okay. And now I want you to pull them out, push them out. Don't let me squeeze them together. Okay. Ready and go. Oh, perfect. So finger abduction and adduction strength is about 4 out of 5. Now I'm going to have you put your thumb to your pinky. Okay. And I'm going to try to separate them. Don't let me. Ready and go. Let's try that again. So don't do this. Do this. There you go. Ready and go. Perfect. So thumb opposition strength is 5 out of 5. And so now we are going to move to your pelvis and your hips, okay? So with your pelvis, I'm going to have you turn to the side for me. I'm going to have you turn to the side, okay? And so I want you to push your butt in, so push your butt out, in, out. So flexion and extension in the pelvis is intact. And then I'm going to have you face me. Put your hands on your hips. And we're going to twist the other way. So rotation of the pelvis in the trunk is intact. Now we're going to bend laterally like with our neck, but with our trunk. Perfect. So our lateral bend, again, is intact bilaterally. And now we're going to move to the hips. So I want you to take your knee and try to bring it all the way up to your chest. The other side, this is the flexion of your hips. And flexion is intact bilaterally. And now we're going to take and kick back. That is extension in our hips. Perfect. Extend the other hip. Straight back, straight back. Perfect. So extension in our hips are intact bilaterally. Now we're going to abduct our hips. So we're going to take our leg out and move it away from the body. Do the other side. Perfect. Our hip abduction is intact bilaterally. Now we're going to do the opposite. We're going to take our leg and cross it over. Okay. And this is our adduction. So our hip adduction is intact bilaterally. Now we're just going to take and bend our knee. This is flexing our knee. Okay, do the other side. So our knee flexion is intact bilaterally. Now we're just going to take and extend our knee. Extend our knee. Knee extension is intact bilaterally. I want you to take your foot out and press it to the ground. So our plantar flexion is intact. Do the other foot. Plantar flexion is intact. And now we're going to take and bring our toes up to the sky. Our dorsiflexion is intact. Again, dorsiflexion is intact bilaterally. And now we're going to turn the bottom of our foot towards the middle of our body. Now turn it outwards. Turn it back inwards. This is inversion. And then eversion. Do the other side. Inversion, eversion. All right, so those are intact bilaterally. Now I'm going to have you sit. And I am going to push against your ankle a little bit, okay? And I'm push it towards the couch. I want you to not let me. Ready and go. Perfect. Let's do the other side. Ready and go. Perfect. Now we're going to do the opposite of that. I'm going to try to push your leg out. Don't let me. Okay? Ready and go. One more time. Ready and go. So our knee flexion and extension strength is 5 out of 5 bilaterally. Now I'm going to test your ankle and your feet, okay? So I'm going to have your feet flat on the ground for this one, okay? All the way. Perfect. Okay. So I want you to bring your toes up like you're just like that. Don't let me push your foot down. Ready and go. Perfect. Again and go. Perfect. So our dorsiflexion strength is 5 out of 5 bilaterally. Now I'm going to try to push up on your feet. Don't let me. Ready and go. Okay. Other side. Ready and go. Perfect. Our plantar flexion is 5 out of 5 strength bilaterally. And now we're going to do the inversion and eversion strength in your feet. Okay. So I am going to push your feet out. Don't let me. Okay. Ready. And we're going to do both feet at the same time. Okay. Ready and go. Perfect. Now I'm going to do the opposite. Don't let me push them in. Ready and go. Perfect. So inversion and eversion strength of the feet are 5 out of 5 bilaterally. Now, I am going to take your, get your eyes closed, so close your eyes. Are you peeking? Okay. I'm going to grab your toe, and I'm either going to move it up or down. And I want you to tell me which one it is, okay? Ready?
Up, down. Up, down. Up,
Okay. Now for the other side. Ready?
up, down. Up, down.
Perfect. So sensation of place of the great toe is intact bilaterally. You can open your eyes. Now I'm going to do everybody's favorite part, which is our deep tendon reflexes. Okay, are you ready? All right. So we're going to start with the arms and work our way down. Okay. All right. So just lay with your arms in your lap. I'm going to start with your brachioradialis. Perfect. Perfect. Brachioradialis, deep tendon reflex is intact bilaterally. Now we're going to do our brachialis. Let me see, I think I might have missed that one. Perfect. So our right brachioradialis is intact. I'm just going to go ahead and do our triceps here since I'm here.
Lucy.
Yep, loosey-goosey. Whoop. Perfect. Triceps, deep tendon reflex is intact. Now I'm going to swap sides and do your brachial tendon reflex here. Ready and perfect. Our brachial deep tendon reflex is intact. And now I'm going to Ready, and perfect. Triceps deep tendon reflex is intact. Now we're going to do the patellar reflex on both legs. And perfect. And oh, I missed that one. Ready, and there we go. So our patellar deep tendon reflexes are intact bilaterally. Now I'm going to do your Achilles tendon. I'm just going to go ahead and pull this up. And just let your legs dangle, just like you were before. Can you put your foot up like this? Okay, now, relax. Relax. Let me have control of your foot. Okay, we're going to go to this other side first. Okay, let me have control of your foot. Loosey-goosey, remember? Loosey-goosey. You're going to have to sit up for this one, okay? Unfortunately. Can I flop it around? Can I flop it around? Can I flop it around? You're not letting me flop it around. You're being stiff. Relax. Do I need to tickle you to get you all relaxed? Okay. Sit back. You're not letting your feet dangle first off. Okay. Perfect. Achilles tendon intact. Okay, you gotta let me move your foot so I can feel where it's at. You're not letting me move your foot. Let me move your foot. Let me move your foot. We're gonna go all the way around town. All the way around town. Bring it around town. Perfect. Achilles tendon reflex intact bilaterally. And now we're going to do what's called Babinski reflex, okay? So I'm going to take this and I'm going to scrape it up the bottom of your foot, okay? It's probably going to tickle. Ready, and go. Perfect. One more time. Perfect. The toes curled downward, which is a normal response expected for her age of development. Babinski reflex is negative. A positive Babinski reflex would be if the toes were to flare outward, and that is only normal in infancy. All right, now what we're going to do is we're going to stand back up. Stand up. Stand right here for me, okay? All right. Now, hands down at your sides, feet together. You're going to close your eyes, and then I want you to stand still and try to not fall over for 30 seconds. I will let you know when those 30 seconds is up, okay? If you do start to fall, I will come to catch you, okay? All right, 30 seconds is up. Good job. Okay, now we're going to do what's called the tandem walk. So I'm going to have you stand here and I'm going to demonstrate for you, okay? So tandem walk, you're just going to put one foot in front of the other like you're walking a straight line. Okay? All right. Can you show me? Put your arms out if you need to. Just walk in a straight line. One foot in front of the other. Perfect. Okay, stay right there. Now we're going to do a heel to toe walk. So you're going to put your heel in front of your toes. And you're going to walk like you're walking a tightrope. If you need to balance, you can put your arms out at your sides, okay? Try not to step on your toes. Perfect. All right. Now we're going to do what's called the heel to shin test. You're going to take and put your heel on your shin and run it down. Perfect. And do the other side. Perfect. So with the Romberg testing with our eyes closed, that was testing cranial nerve 8, or vestibular cochlear. So that nerve is intact, as she did not fall and only had to correct herself minimally. Now we're going to test hand-eye coordination with the finger to nose. So I'm going to hold out my finger. I want you to look straight at me. Okay, keep your head still. Don't move your head to follow my finger. Only use your eyes. And as my finger moves, I want you to touch my finger. and then immediately touch your nose, and then touch my finger as it moves, and then touch your nose, okay? We're going to do it with your right hand first. Are you ready? Go ahead and go. Perfect. Now we're going to do your other hand, and go. Oops, sorry, that was out of your reach. That was my bad. Perfect. Hand-eye coordination is intact, so all of our gait, our balance, and our cerebellar cortex is all intact and appropriate for developmental age. Now, I think we've done everything. You've got some awesome strength and balance there.
Yeah.
Oh, wait, no, we do have one more balance test. Do you think you're up for it? Okay, so I will give you my hands in just a minute after I show you. We're going to do, it's called a shallow knee bend. So you're going to kind of put your feet kind of shoulder width apart, and you're just going to slightly bend your knee. Keep your back straight and slightly bend your knees. If you need my hands, you got them. Here, hold my hands, and I want you to do like you're going to squat down. Perfect. All right, so everything everything looks good. You did fantastic. You're very awfully strong. Next time I'm doing something, I'm going to have to bring you to my office, okay? Well, it was nice meeting you today. Thank you for coming in and let me perform this assessment, and I hope you have a good rest of your day.
Bye.
Bye.